So I'm going to share my screen with you. I have a small, about a 15-minute or so PowerPoint to go through regarding changes to PA education since COVID happened. Give me 1 second. Unfortunately, I can't see the rest of the screen to know if you all are hearing me and seeing this. So I'm going to go with it. So again, my name is Kasey Dillon. I am an assistant professor at Mass College of Pharmacy and Health Sciences in, you can't see the screen. Can you? I'm sorry, hold on 1 minute. Okay, you can hear me, but you can't see a screen. Perfect. You can see my screen. I know somebody else on this call and I'm texting with them. So perfect. Okay, let me start again. So I am Kasey Dillon. I work at Mass College of Pharmacy and Health Sciences in both New Hampshire and Massachusetts. We have 3 campuses as part of Mass College of Pharmacy, and several faculty have been on this at this virtual fair today. So you probably have heard some about our program, but I primarily work on the Manchester, New Hampshire campus. I live in New Hampshire and have for most of my life. So I was asked today to speak a little bit about how things have changed with regards to our educational platforms and some of the things that we have done post-COVID-19, or I suppose in the midst of COVID-19, to continue to educate our students in the most effective and best way possible. So just quickly, this is me and my family. I have 3 kids and I am married. We do live in New Hampshire. I'm from New Hampshire. I went to PA school, let's see, it'll be 15 years ago that I graduated this August in Arizona at A.T. Still University. We had a campus out in Arizona. There still is. It was a great school. If any of you are looking or living in Arizona now, I do miss it. But and I have worked primarily in emergency medicine. I have done a bit of pediatrics, and I have also worked in an urgent care setting in conjunction with working in the emergency department. So I launched into teaching full-time about 2 years ago. I had done some adjunct work prior to that and have always taken students, or at least in the last 10 years or so when I was working full-time in the emergency department, did take students with me to rotate through, and have always really enjoyed teaching. And so this has really been a fun transition. I still work about 1 day a week in the emergency department. So in my opinion, it's the best of both worlds. I get to teach and I still get to do what I really love to do, which is treating patients in that setting. So I just wanted to take, again, a few minutes to kind of go through for you all as you're looking into the PA profession and what that might look like for you. It certainly has changed, as has most with our entire lives in all aspects. We've all had to make some pretty drastic changes. And so I'm going to take a few minutes and just talk about some of the changes that we have sort of taken on and the adjustments we have made within our department and within our university. I will say this, that I hope that the COVID-19 pandemic and the changes that have occurred, some of the transitions maybe you've heard about, does not scare you off from this as a profession. Being a PA for 15 years, I think it's one of the best decisions I've made. I came from a therapy background, so I was actually an occupational therapist for several years before PA school, and absolutely never regret my decision. So it is a great career. It's a great path that you're looking into, and some of you have already chosen, and it's a great lifestyle depending on what you choose. So despite the changes that we're talking about, again, I think it should continue to encourage you to pursue this. So again, you may have heard a little bit about Mass College, where I am teaching at now, if you've been in some of the other chats. but it is an accelerated program. We have 2 campuses that are combined. So it's 2 campuses, 1 program with a total of about 124 students divided somewhat equally between the 2. The Worcester campus is a little bit bigger with more space for more students. It's completed in 24 months, and you can see the total credit hours, which is a lot of credit hours, as you all have probably picked up on today. It's a lot of credits in 2 years. Our program, like most, is divided into, it's about 18 credit hours per 3 semesters in the didactic year, the first year, and then the clinical year is about 15 or 16 credit hours per semester. We are on a trimester system, which is, I think, pretty typical. And like I said, we have 2 campuses, which allows us to, I think we were in a position to do some distance education already, because we have 2 campuses, 1 set of faculty, and we were already doing some distance education on a regular basis, daily basis, with our lectures and labs. So in terms of COVID-19 and the global pandemic, I tell you, we were forced to change, and we were forced to change quickly. We had spring break. We were in our first semester. I primarily work in the didactic year, and we were in our first semester with our cohort of students. They went home for spring break, and they didn't come back for 2 weeks, and then they didn't come back at all. So we extended our spring break out a week, and that allowed the university and our program to make some adjustments, and the decision was made that after this extension, students would not return, at least for the remainder of the semester. So much was unknown that we made a quick decision, as did most programs, and we were forced to move our primarily in-person, somewhat typical form of education to an entirely remote platform of learning. So when I say that we were forced to make changes and we had to make them quickly, it is because of national and local restrictions, which you all probably know too well. All of the requirements like social distancing and PPE, remote learning, lockdowns, the gathering sizes, travel restrictions, and travel bans. We certainly have a diverse population of students at Mass College of Pharmacy, which is amazing. And a lot do not live locally, and some live internationally. There certainly are varied positive cases state by state, and that's changing on a pretty regular basis. There's a lot of individual challenges and stressors, as some of you know as well, or all too well, being at home completely, having your entire family home. It changes the dynamic of productivity and what you're able to accomplish in a short or the same period of time. And then obviously we all had to consider what this was doing to our health system, and economically how it was impacting all of us. Some people have lost jobs, right? And some, even within the healthcare sector, had their hours and income affected. So when I say it's a fluid situation, that has forced us to make fluid changes. So changes is my key word here. We, as a program, and again, I suspect I speak for most programs, we're forced to make changes and to continually adapt and make changes. So it was not a static process. It still is not static. And I think that's actually a really good thing. I think it forces us to evaluate, to see how things work, to iterate, to make changes based on what we find works and doesn't work. And it's a good process. So it required us as faculty, and honestly as our students have experienced this with us, to commit to change that is grace-filled and has a bit of, just some flexibility, a willingness to accept that flexibility as the new normal, and awareness that there is a huge value to communicating clearly in various formats across various platforms. Communication is key in this setting when we're all doing things virtually. Again, I'm sure you've all had some experience with this over the last 4.5 months. We had to get pretty creative. We had to acknowledge that we had to think outside the box in a lot of ways to make things better, and at least make them equivocal or equivalent to what we were doing before. And realizing that this too shall pass, that there will be a new normal. It will occur at some point. None of us know when or how, but I'm not entirely sure that PA education will ever look exactly the same. And I'll explain that to you in a minute. Now, I certainly do not claim to be an expert in any of these things. I'm not an expert in pandemics. I'm certainly not an expert in education by any stretch, but I can speak to what I have seen and what we've experienced, what I think is good and what I think is positive in the way of PA education. So just a little bit of comparing and contrasting. Some of you are probably more familiar than others with what the education looks like and across the didactic year in a PA program. But we typically have lectures that are done in person, and we have hands-on clinical skills, patient assessment labs. So pre-COVID, we very much had that. We had a simulation lab, and we had a patient assessment. PA stands for their patient assessment or clinical skills lab that the students attended once a week for several hours, sometimes more often than that. During COVID, I won't say post-COVID because we're certainly not there yet, but during COVID, we were forced to make a transition where obviously we couldn't gather in a group in person. So we began adjusting our lab sessions to be Zoom, based in Zoom. That's the platform that we have used in our program. And we have done lab in both large and small groups. We get together with all 120 students and have discussions, which actually is possible. And it has worked far better than I think we thought it would. And we've been able to break up into small group sessions, groups of about 9 or 10 per one faculty, and experience or go through more lab skills and case studies. And, you know, I would put in quotes hands-on, because some of our hands-on creativity required students to watch us performing on the Zoom call, and then they would have to reproduce the exam skills on somebody in their house. Some people didn't have the ability to have somebody, so they used a doll or whatnot, and they would take videos and send them back to us for us to give this sort of dynamic feedback about what the skills they were able to accomplish and learn. We switched over to a platform called iHuman in our program, which is an online platform that is designed to teach patient assessment, clinical decision-making exam skills, again, in an online format. And I would say that it actually has worked out quite well. I think it is a great, it would be great to implement into our program. It certainly is not the same as being in person with a live human, but it is a really good program, and the students have responded really well with actual simulated patients that speak to you when you're going through the cases. And there's a lot of options. And so we have used, we've used that platform within our patient assessment lab and even in our clinical year. Like I mentioned, we have classroom lectures, and the students are in lectures for a good portion of the week, no doubt, during the day. And we've had to switch over to doing that all via Zoom. Again, the platform we have selected to use in our program. And we have the option of students attending live lectures. Most of the faculty will give and deliver lectures live, but they're also recorded. So we understand, again, flexibility, kids and family dynamics and economic strains and time changes, that we have recorded lectures as well. So you don't have to attend live, though I will say most of our students do get on the call live, and I think they really appreciate it. Just a few more changes pre-COVID and then during COVID. So I am the SAPA, which is the Student Association of the AAPA, which is the American Academy of PAs. We have a student organization. I am the faculty advisor for that. I have been for the last couple of years, and we do a lot of community engagement and outreach, and typically that's done in person. So we've made a switch, and the students this year have done amazing at doing some online fundraisers and continuing to engage in an online format, which has been great. Certainly, you're all familiar with being in college. You have office hours with your faculty advisors and your professors and whatnot. Those have all been switched to either Zoom via Microsoft Teams, another platform that we've used, or even via email. So a lot of communicating that way. ExamSoft is the platform, the online, it's the testing software that we use to do exams for students throughout the first and second year. That used to be done in a classroom setting. We now have the ability to use ExamSoft with virtual proctoring, and that has proven to be quite effective. So students are taking exams in their homes with a virtual proctor. And then finally, Blackboard. We also use Blackboard as one of our main platforms of communication with regards to assignments and lectures, lecture content, discussion boards. And so when I say Blackboard times 10, we were using Blackboard on a daily basis before, and now we're using it times 10 on a daily basis to communicate with students. So in terms of the fall semester, again, like I said, we're on trimesters, so our students are wrapping up this summer semester, their second semester, in a few weeks, and we have about a week and a half or 2 weeks off, and then we jump right back into our final fall semester. And so our university, like many, have switched to a hybrid platform for the fall. We haven't looked much beyond that as a program, or I suppose I should say we have, but we haven't decided on anything because it's such a fluid situation. I think that's smart. We are doing a hybrid platform, meaning that we are going to be on campus for the first 5 weeks, starting at the end of August through the beginning of October. And we are going to be on campus in small groups, no larger than about 13 students and a few faculty, trying to keep that sort of cohort model you've heard talked about, where you're with the same students, you have the same lab partner, and you're limiting exposure to as many people as you can. And we are going to run 2 courses, patient assessment, our clinical skills course, as well as medical procedures and surgery. That's the course that we do where we teach suturing and intubation and abscess drainage and joint injections and things like that. And those are 2 courses we decided as faculty there was just no way to move students through to their clinical year on rotations without having hands-on lab time. And so it's been amazing that we've been able to switch to a 5-week intensive hands-on just lab, lectures on certain days, but primarily lab time in small groups. Our lectures will continue to be delivered, all of them remotely. No classroom lectures will be delivered. Exams are still taken remotely. And we did extend the semester by a week to be able to get in all of the things we needed to. Like you probably heard, most universities, even if people are on campus, nobody returns after Thanksgiving, and that's the case for us. And so finally, I would just say, I guess I would leave you with this, is that when I say with change comes promise, I think that probably all of us could look back at this time in the last several months and think, okay, this has been really hard, but there are some good things that have come out of it. I tend to be a glass half full kind of person, and to try to always look on the bright side, so to speak. And so I wanted to just point out some of the strengths that I have seen come out of the changes we've been forced to make because of COVID, and where I think there are still some weaknesses. And that might give you some idea of maybe a better way to prepare, or at least have a bit more insight into what may be a struggle for you based on these changes. So I would say that being at home, myself and then people I've spoken with, students, faculty, it's convenient. You don't have a commute time. In some ways, you have more time that you can spend doing what you need to do because it's convenient. It is self-paced learning in a way that is different than when you're in a classroom and forced to maintain and keep up with all of the lectures. As you all heard up, I'm sure, I mean, it's a lot of information in a short amount of time. And if you fall behind, it's almost impossible to catch back up. And so it does require a lot of independent self-motivation, a lot of self-directed learning in a way that it was not quite so obvious in an in-person, typical university style platform. Again, I mentioned that I think there's the ability to be more productive if you can be diligent and self-directed. And I think that it is, we have some pretty amazing digital platforms that we've all become quite accustomed to, and we've gotten to use those, become familiar, and really take advantage of all those that platforms have to offer. And I think that we will continue, even when we go back to a more, let's say, again, in quotes, regular type of educational setting. We will be able to engage with those platforms, I think, still, which I think we might all argue is the way of our world. I think COVID, there will be a post-COVID, but with that is going to come a whole lot more digital engagement and online engagement than in person. I think some of the weaknesses I have seen is just that there is limited social engagement. And I think a lot of PA school is being able to be encouraged by those around you that are struggling just like you are, your peers. And it's harder to do that when you're not in person. However, our students I have seen have really maintained a lot of strong connections and continue to be a very good support system for each other. I think there's obvious challenges with hands-on clinical practice and clinical skills training because we are not in a typical lab setting, but you can see we've adapted for that in the fall. There have been many changes to rotation schedules, clinical rotations, availability. Obviously, there are some settings that are just not prepared or ready or safe for students yet, so there's been some adaptations there, some potential delay of graduation by a few months. And honestly, in the whole scheme of things, that is not particularly a terrible thing. It's a few months and it's life. And a strength of can also be a weakness, right? So the strength of digital platform use can also be a weakness. And if you're not comfortable in that world and navigating the world of digital, then it could be a real challenge for some to be able to maintain all you have to maintain from the confines of your house. So again, I would leave you with just that with change, none of us like change. We don't tend to adapt well as adults when we're used to our own routines, but sometimes it forces goodness. And I think there's been a lot of good things that have come out of this and will continue to. I suspect we will be back at some point to the way that we were doing things. But I think some of the changes that we have seen will remain, certainly. So hopefully this is, again, helpful to you. It's just a few ideas, a few suggestions of some of the changes that we've made. And I think our students really have done an incredible job adjusting and learning the material in a really effective and efficient way. I'm going to stop